Salam and peace. You're watching Muslim Network TV on Galaxy 19 satellite, or you may be on Amazon Fire TV or Roku, or any of our social media. But Muslim Network.tv is always there. It's a 24/7, the only American Muslim television satellite in the world, for that matter. This is your host Malik Mujahid, and pandemic is rising, and we thought curve is big flattening, and so people started relaxing. Some just to be on the beach, and some in the protest, and whatever is the causes. So most of the beachcore areas that is coming up, not the area that protest, it is coming back roaring in America. And our CDC leader is saying that, Dr. Fauci, that maybe some of these states need to put against the lockdown sanctions and instead of relaxing the situation. What is happening in the world? What is happening in Pakistan? I mean, last time we talked late May, Pakistan has only 61,000 cases and 1,200 people dead. Now Pakistan has 45 million cases and about 5,000 people are dead. But these statistics are correct, or statistics collection is a problem. Pakistan is the fifth most populous country in the world, with more than 212 million people. To discuss the situation in Pakistan, we have a leading physician from Pakistan. He is founder of Indus Hospital, Dr. Abdul Bari Khan. Welcome to Muslim Network TV. Assalamu alaikum.
Wa alaikum assalam.
So, Indus Hospital is Pakistan's first non-fee hospital. Nobody will ever bill you or charge you anything. Dr. Abdul Bari Khan's career reflects his love for medicine and his unwavering sense of the community. I hope you're safe and healthy.
Alhamdulillah. Alhamdulillah.
So we keep hearing that some of the Pakistani top physicians are getting sick because of that.
Yeah, advisor to the Prime Minister on health is also positive now, COVID positive for last 2 days, 3 days.
Okay, so I hope the physicians need to save a lot of lives. I hope they stay safe. Yeah. And also the part of United States, what is happening here is a Pakistani American, Dr. Mansoor Ahmed. Dr. Mansoor Ahmed is welcome to Muslim Network TV. Dr. Mansoor, Assalamu alaikum.
Thank you for Assalamu alaikum, Dr. Malik Mujahid and Dr. Bari. It's good to see you. It is really, I think your last meeting with us was very inspirational. And as I mentioned, that we have created this.
Yeah, we will talk about it a little more. Dr. Mansoor Ahmed is a physician in Cleveland, Ohio. He's a community leader in the Muslim and Pakistani community in Ohio. And he has been practicing for 20 years. So situation in United States is worsening. We have multiple epicenters instead of just New York being the epicenter. And there, in the last 2 weeks, I think we have set at least 6 or 7 records, including today, more than 59,000 cases. So what is the current situation in Pakistan?
Currently, Pakistan, what the surge which we had, the peak immediately after a week after Eid, now we are seeing some flattening of the curve. Last 24 hours, there were 3,200 cases, so and only 61 deaths. So it is appearing that is easing out.
Okay, so that's a good news because the ratio.
Yes.
But what do you think about the statistics? Are statistics being properly done? Because if you're going to do, a bad part of collecting data, then data will help you feel satisfied while situation may be not that good.
No, I think so. The there is a data which we get. There is testing. So in last 24 hours, we have done about 24,000 tests, which is much. The numbers have increased a lot since last we met. So the other thing which gives you the indicators are, as a doctor, as a practicing doctor, I used to get calls from different people who know me and asking for availability of bed in different hospitals. Used to be about 30, 35, or rather 50 calls a day, uh, knowing me and asking for the availability of blood in Indus or any other hospital. That has gone down to, or last 2 days has gone down to about in single digit now.
Hmm. So it's not only the statistics, but your personal observation is that things are improving in that
Yes,
area.
that's not only my personal observation, also our colleagues, because we exchange notes with each other and we talk about, because the data from Indus Hospital is usually biased because the quality of care is good, so everyone wants to be at Indus Hospital. So, but now we see the load on in the emergency has gone down, but it's not that we have free empty beds in the emergency, but it is not like that the people are waiting outside to come in. So we have few, one or two empty beds, which was never. We had to add some extra stretchers to accommodate people who were sick and to get them into the emergency department. There are few beds available in COVID unit also.
So, Dr. Mansoor, what is it? The United States, with better medical facilities, with better, more hospitals, and I mean, and of course, one can blame that people are not practicing social physical distancing, but in Pakistan, people don't practice physical distancing also. So, is there, do you think there is some importance to this idea of the hotter climate will have lesser cases? Are those theories and hypotheses about the herd immunity? I mean, why people were expecting worse situation? Even when we talked last time in May 27, we're expecting worse situation, and it seems situation actually is improving over there, worsening in the United States. So, what do you think?
Well, I think that that there's no evidence yet that the weather plays a role. I think there are different hypotheses which may explain what is happening in Pakistan, and they are. And first of all, I agree. I think the good news is that things are better than what we thought. I'm really relieved and heartened to hear that one. And now we can bring the different kind of scenarios and explanations to why that happens. I think weather, right now, if you look at the weather alone, Arizona is the worst right now, as among the worst hit state, which is the hottest temperature in the United States. So that theory is out of the window. Then we talk about the last time that the relatively huge population in Pakistan. I think people that who get infected, but they are asymptomatic. They don't get any symptoms at all. I think that's the nature of the disease, and perhaps you can argue that since the more younger people, there are a lot more people infected, but they are not basically sick. Uh, so that's another. But then, of course, that the idea of the TB, the past history of the BCG vaccination, which basically creates some innate immunity, which might be protective to Pakistan. And the last, which is still not clear, is this virus variant that we have in Pakistan, the COVID. There are different variants. Is it different? Its virulence is different than what we. So those are the four or five. I think Dr. Bari basically can pick up any of those hypotheses and maybe have a better handle.
But yeah. But to my knowledge, BCG is out of window because in UK, uh, majority of the Asian population were affected, and the mortalities was more into the Asian population. So that is out of and the severity. I don't think so. There is any mutation. It's the same virus everywhere, but youth is the factor, the blessings which we have, the younger population. That may be the reason. And if you talk about the statistics, so we have about 240,000 patients, about 241,000 patients up till now. But I think so the numbers will be more because I had some friends who called me that my son had a COVID positive, and now the whole family is having some sort of symptoms. So I asked them to get yourself tested. They said it will be COVID. And what we have to do is we have to just isolate ourselves for 10, 12 days. So what's the use of getting tested?
Mhm.
So let's take it as a COVID and isolate ourselves. The whole family is sitting in the home, and they all uh, recovered. And so I think it is, if the number would be more, but we don't have statistics because uh, if I take five members of family, so it will be around 800,000.
So, Malik Mujahid sir, this is that if you, let's say that you take a a population like a Gulberg and start testing everybody, then you will have the different results. Testing basically means that either you do the virus PCR testing or you do the serological testing, depending upon what test you are doing. Then you will find that far more patients are infected than actually are confirmed. So there's a difference between confirmation of the patient. And then there are issues here that patients, as Dr. Bari said, that are reluctant to go to the to get diagnosed, are reluctant to let the authority knows because there was a initially was concern about that they will be taken out from the, that's the myth. I've spoken to a lot of people that if you have a diagnosis, then they will put you in the quarantine and in a facility which people don't want to go. Then it's some sort of also label that everybody start to shun away from that. So there is a social also concern, and then of course the it is a, I think it is a relatively the testing are not uniformly available in everywhere. I think to get to that test and all that, we can't afford the testing what we have. Even over here we have a problem. So lack of sometimes availability of the testing, the social taboos, and we can only perform so many tests. And if you do more testing, then perhaps that it will be not likely, but yes, definitely there will be far more people who are actually are infected but not diagnosed to have been infected.
Well, share this with me, Dr. Abdul Bari, that I mean, right now I have just 1 week. I mean, I didn't have this situation in March, April, May, or June. Right now, my first cousin is in ICU in Pakistan, and one of my another relative, just in 5 days, she's 30, 34, 35. She just passed away. So as far as I'm concerned, it is coming closer to the family. I'm glad it is. How much testing is available to people? Can people be tested on demand, or only when they are really sick they could be tested?
I think so. The capacity have increased, and the government is providing about 80% of the testing in province of Sindh is free. 80% is free, and we the capacity is we can do about 14,000 tests a day in whole of Sindh, and people can come over and get tested. And the other thing which we do when we get a patient into the hospital, we go for contact tracing also. So getting testing is not. I think so. It's better than US because you have to say my son. He is doing residency in Shreveport, Louisiana. So he had symptoms and he went to the hospital. They said, okay, you take this thermometer unless you have a fever. When you have fever, then come over. So after 5 days, he got fever, and then he was tested because it took, and then he got the result in 3 days.
Mhm.
So that in our hospital, we are giving uh, within 24 hours the results are being given. So there is the testing is there, which is most of the time it is free. The other thing which I think so, as you said, initially when in the month of March or April, we seldomly know that someone is affected. Now it almost every family has some connected people affected by the COVID virus,
Mhm.
and that is why, because in those days, which is March and April, people were not accepting it. There's some virus which is going to affect them. They were saying it's something else. It is a conspiracy, and but now people are afraid. Now they are scared that now it has come to your home,
Hmm.
your neighbors, your near relatives. So every house has someone affected, known to them, be it a friend or a relative or a neighbor or a colleague. So you know now.
Hmm.
So
So it is people are becoming more careful also.
yes, now people are becoming careful. Previously, people were saying it will our houses, we are not affected, our neighbors are not affected. So the government is just making it uh, basically creating uh, scares in the
Hmm.
city or in the country. They have some motives, but now that has all died out now.
Thank you so much, Dr. Abdul Bari. Dr. Abdul Bari is connecting with us from Indus Hospital in Pakistan, Karachi, Pakistan, and Dr. Mansoor Ahmed from Cleveland, Ohio. You're watching Muslim Network TV on Galaxy 19, as well as many other places. We'll be right back after these messages. Welcome back to Muslim Network TV. This is Imam Malik Mujahid, and I'm talking with Dr. Abdul Bari in Pakistan and Dr. Mansoor Ahmed in Cleveland, Ohio. You mentioned that tests are more easily available. It seems in Pakistan than they were in the United States. So we'll ask Dr. Mansoor to respond to it. But tell us about what is the quality of these tests. You mentioned that results come in within 24 hours. But are these tests of quality? Because I have heard that the quality of tests differs from one test to the other.
It all it all depends. Basically, initially there was the issue of the availability of the kits, quality kits. So majority of the kits which we were getting were from China, and those were basically less sensitive. So now we have quality tests available. We have automated machines available. The Roche company kits are available. Abbott company kits are available. So the quality almost there may be some differences between different labs. Most likely, the public sector labs have more quality uh, kits than private sector because it is basically procured by the government, and we have good machines there. But private sector, they want to make money, so they will invest in low cost kits which have quality issues.
Hmm. Dr. Mansoor Ahmed, why America is still taking more time to get the test results, and why we are failing in this area?
Lack of governance.
Well, when in the lack of awareness, people associate for longest period of time, people associate that with Pakistan, not with the United States.
Yeah, I think that the given all the circumstances, I must say that the given the economic limitations of Pakistan, giving the population and the infrastructure, the money we spend on the healthcare, I think I'm uh, I'm keeping my finger crossed. I'm so pleased what I'm seeing in Pakistan. I must say that one. I have gone through usually we always say, well, this the private sector steps up and the NGO steps up. They are doing, but I think that given all that, I think with all the limitations, I believe this crisis, I think I cannot imagine that any government could have done better. I think the results speak for itself. Initially,
Yeah.
we were very skeptical. There was some, I think, confusion about the Eid and the prayers and I think that the how much pressure the religious community basically will exert, and Imran Khan changed the decision. But I think all in all, I think there's a very tight rope that our prime minister has to walk to address those sensitivities and still keep the going. I think he has a very good technocrats and technical team. I think committed people like Dr. Bari, Dr. Faisal, and many of those which I don't interact, but I think knowing them. So he is good surrounded. He knows how to get to the right people.
Well, let me tell you this.
That's what I think.
It
Imran,
is extremely rare for me to see two, three Pakistanis who talk anything positive about Pakistan.
no,
So
no, no,
this
no.
is very surprising.
I think that we
So,
basically, if we have that model in the United States right now, I think that from the leadership, no doubt that we have the best scientists. I think these are the iconic leaders which we known them ever since we came to the United States, Dr. Fauci and all that. I think it's not the lack of the talent, the potential, the academic reservoir, but I think ultimately it boils down to all these things can be rendered useless that if you don't have a leadership and the clarity of exactly. So we have sort of mixed the disease with the politics. I think that's the toxic combination that what we see otherwise. I mean, how can you compare any country? Vietnam is a good example. I think there
yeah.
are many other countries who have both so limited resources, but the good governance, I think, speaks. I think is very, very, very important when you are dealing with the pandemics. Without that one, you have got 50 countries, not 50, United States, one United States. There are 50 different countries, and all these they are fighting for their own. I think their own political sort of that where that how the mask wearing, even the simplest of all those things, has become like a political issue, a symbol of machoism, the symbol of your courage that you wear the mask, then you are basically among the coward. If you I mean, transform a deadly disease and look from the political prism, there is a problem, and that's what you are seeing in Florida and Texas and other country and other places. And of course, then Americans, I think that there's some, it takes them to they're not used to. There's something can be so minutest thing called the virus can subdue them, and they can't have their liberty. They can't go to the bars. They can't have the social gathering. Who the hell are you to tell us what to do? I think the societal, social. And I don't want to put all the blame. I think to the governance, but these are also cultural. I think issues which I think have led to where we are right now. That's my. I think not being an epidemiologist, I don't want to claim to be, but I think just observing my and sharing what I think has gone wrong with the United States.
Hmm.
The other thing which for Pakistan, basically, if you see historically, if you see Pakistani nation, we are a very different nation. In in normal circumstances, we are the bad nation. But if you see the time of crisis, be it an earthquake of 2005 or flood of 2010 or 2011, or now this pandemic, the nation is one. So everyone is contributing. So be it they're having some differences, but we all respond. People come out. People give money. People give rations to the people who are during the lockdowns. I people were saying the poor will die, daily wages will die because of hunger, but not a single person has died because of hunger. I don't believe it that anyone can die of hunger in Pakistan. So when in crisis, we are a different nation. But in normal way, normal days, you as you Malik Imam Malik, you said, okay, three Pakistani talking positive. But if you see during crisis, you will have some positive Pakistani talking positives. But in normal times, you will not have three talking positive in one platform.
So for good governance, books need to be revised. That for Pakistan, that they need to be given crisis every other month, so they improve few of the things. Tell
Yeah,
us this: that in I was watching in a, I think it's Methodist Hospital, if I remember correctly, in Texas. Instead of putting people on ventilator, they are putting them on, I think, some type of transfusion machine. So
Mhm.
blood is taken out from one side and oxygen is added, and it's back to the person, right? I mean, they're recycling through that, and they're saying that they are getting better results than the ventilators, which are causing more harm than good from their perspective. I don't know how widespread it is, Dr. Mansoor Ahmed, and Dr. Abdul Bari, do you think that this is something some people in Pakistan are trying in that area? Because they seems to be giving good results there.
Um, Dr. Bari, of course, as a cardiac surgeon, knows very well. It's called the ECMO.
yeah,
uh,
yeah,
and it is essentially without there are two ways of oxygenating patients. One is, of course, by putting on the ventilator and very high setting, high oxygen. I think that sometimes doesn't work in this COVID. It looks like many patients will not respond, no matter, even when you're giving 100% oxygen, no matter whatever the ventilating settings are. So then when you cannot oxygenate the person through all the available means, ventilator and oxygen, then ECMO, which essentially exchange the oxygen, take the CO2 out and give the oxygen via just like a dialysis kind of a thing, oxygen dialysis, so to speak. And it may very well be because the answer, but it is Bari will know that very well because I've not done ECMO myself. I'm just talking from the theoretical knowledge. It is expensive, perhaps, than the ventilator. It is not, you need a lot of technical expertise to do that. But
yeah,
yes,
yeah.
certain cases can be very, very, very effective. And there's a whole different pathophysiological reasons that why ECMO can be better. But I will stop there and I will ask Dr. Bari to share his experience and availability of ECMO in Pakistan.
Basically, you're right. It's an expensive machine. The kits, it's expensive. It has some limitations, and there are very few ECMO machines in Pakistan. So in US, almost every center has it where they do cardiac surgery. But it is not as widespread because basically it's an artificial lung. So
Hmm.
you give rest to the lung,
Yes.
which your natural lung, because it is affected. The membranes cannot work, so you give rest to the them and use artificial lungs to give. But it is expensive. The availability of the ECMO machine are not that widespread as it is. But in US also, it will not be so widespread. It will be in some limited centers also.
It's a
Okay.
dialysis, lung dialysis. You can call it a lung.
Yeah, it would be just Mansoor Saab, you explained very well.
Okay. All right. So Dr. Abdul Bari, last time when we talked, you were concerned that there are not many ventilation machines. And Indus Hospital, under your leadership and talking to some people, you're working on developing inexpensive manufacturing of ventilators in Pakistan. So, what stage is that particular program?
So there were multiple efforts being carried out in Pakistan to develop ventilators. So there was one with the army, which is now it is being now in use. Our ventilator is almost done. So it is now into running as we are seeing it because it needs it's a very important machine because and we have to be 200% sure that it will work uninterruptedly for days and months and so that testing is being done. It will we may not be able to use it during hopefully during this COVID which we pray that it should not it should not extend beyond Eid, but
Mhm.
this crisis has given us the opportunity to develop a ventilator which will be hopefully which will be world class, and we will be using our own in Pakistan, and it will be available for other countries to use it.
So, so,
Inshallah.
so at this moment, testing is going on. How many of those
Yes,
machines are being tested right now?
it's basically two machines are there. Like, one was the basic model, and the other one higher end model. Both are being. There's a prototype is ready, and they're on. Basically, they were used on in animals, which they have worked, and now they are using into one of the ICUs.
Okay. So, what cost came at this moment? Probably cost will be higher, right?
Yes, it would be higher, but the basic model, we have managed to get it done within $250. So, and the higher end would be around $1,500.
Okay.
Okay.
And so you have manufacturers ready to manufacture it in larger quantity?
Yes, yes, yes. We the people are there. They will be doing it.
Will
So people have
they
changed.
be able to reduce the cost by once they start manufacturing, or cost will
Uh,
stay?
no, no, it will come down,
Okay.
because now it will be in numbers, and also it will be almost 1/10 of whatever, rather 1/20th of whatever we get from outside. The
Mhm.
other thing which we have been able to do it and which has worked is which
Before
we
Dr.
have,
Bari, before we go to the other thing, what is the one which you're saying Pakistan Army has developed? So what cost they have developed, and are they in the manufacturing phase already?
yes, yes, they are in the manufacturing phase. I just read somewhere yesterday that's about they have produced almost 100 ventilators. I'm not sure about the cost, what cost they occurred into it. But the other thing, which is basically, which was very simple, is the VTM, which is the virus transmitted transport medium, and the swab, which we use for taking the samples out. So we have validated now. It is now in draft for approvals, and the cost is about 40% of what we were importing. So about 120 rupees for VTM, the tubes which were carrying that, and the swab. So it would be 120. When we'll go into the bulk, it will come out to be 100 rupees.
So you're talking about rupees, not dollars. I thought you're
No,
talking.
no, 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 rupees. So
Okay.
it is less than $1 now, and today's exchange rate, it is less than $1, about 80 cents.
So you're saying that the approval, that it has gone for approval. Who
Yeah.
approves these things in Pakistan? I thought it's a free country.
No, 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 no. It has basically, you have FDA, we have Drug Regulatory Authority, DRAP, Drug
And
Regulatory
I think they
Authority of Pakistan.
are responsible professionals, and not
Yes, yes,
those
yes.
who could be corrupted by giving some money.
No, 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 no. On the contrary, they take a lot of time. It takes about 6 months to get one thing approved. But during this pandemic, they have reduced their time, and they have, as FDA is giving for emergency use only, they have also come up with some shorter periods to that, because at this moment the whole world is affected.
Hmm.
So there is the logistics problem. We cannot import from outside. So which basically led to uh, make ourselves in locally.
Okay. You're watching Muslim Network TV. This is Imam Malik Mujahid, and I'm talking with Dr. Abdul Bari from Karachi, Pakistan, and Dr. Mansoor Ahmed from Cleveland, Ohio. We'll be right back after these messages. Welcome back to Muslim Network TV. This is Imam Malik Mujahid, and our guests are Dr. Abdul Bari from Pakistan and Dr. Mansoor Ahmad from Cleveland, Ohio. Dr. Mansoor Ahmad, there are so many Pakistani physicians in America. Are they trying to help Pakistan in this situation? What you guys are extending yourself?
Yes, indeed. As you said that, I think our diaspora community, I think, has always stepped up. I think at individual level, at also at the organization level. I think I was very impressed with the some of the programs. I should say with APNA, the merit program, where they have a very nice
APNA being the Association of Pakistani Physicians
of North America. I participated in some of their webinars and the different themes they are bringing. I think they're much more organized than they have been in the past. I think they've done impressive work with the COVID. So that is one, I think, at the organizational level. Then there are, of course, the other umbrella of organizations here in the United States. I think the ICNA, and then there's a whole umbrella of the organization which are trying to basically.
No, I mean that just in the area of professional
yes, and
help and guidance.
Medicine, second opinion, for example. I know that that very large number of physicians that who have shown tremendous interest and enthusiasm if they can offer a co-management or second opinion or educate the primary care physicians. I think these are I think all the way to people that who are practicing and independent doctors who are in academia. I think they are, really, I think, and then there's a physician who is the ICU specialist, and he developed a very nice program. It's like a small video, video patient education programs, which are, I think, very nicely done. I think very easy to understand. He has translated it, and he's doing it with his own money and giving the free video for the COVID now. I think he's putting a lot more focus on the COVID. And so that's an education. I haven't seen anybody that done that. He's the most unique person. This doctor is in Dr. Ehsan. He's in Cincinnati. And then, of course, I can name so many people. I think Majid, he's in Harvard. He's the interventional in charge of. You met him the last time he was here, and then there are young resident. I think they put together the oxygen protocol. They are fellows and all that, and they created what we call the Pakistan for Ventilator, a small organization, despite the fact that they are in residency. Very heartwarming. I think people that at least I know them, I'm really touched. I think humbled by these young youth people that who are really have within their residency. It's a very difficult time, but the amount of effort they are doing that, they just need, I think, a little bit more focus and direction and all that. So I'm very pleased.
So, Dr. Mansoor, we say in America, Islam has a PR problem. I would say that Pakistan has a PR problem, and so does Pakistani physicians in America. Not many people in America know what Pakistani physicians contribute. How many are Pakistani physicians in America?
Well, you have Apna. I think I would just guess you, okay, and then don't, I think, hold me on that one. I think 15,000, 20,000 physicians.
So there may be about 50,000 Muslims altogether. If 15,000 are just Pakistanis, there may be more when you count all Muslim ethnic group who have.
It's a very large community. I think one of the largest. I believe that they are. I think that they are one of the largest Muslim community after Pakistani or is the Syrian Muslims community. I think they have done an awesome job for their own crisis. I think Syrian Medical Association. Creating the virtual ICU clinic, putting the hospitals and all that is millions of dollars. They came from nowhere, and I put them in touch with Apna, but I think they exceeded the expectations. I think they have done an awesome work for the crisis. When everything was destroyed in Syria. Yeah, there's another group of physicians I think that should be acknowledged. What they have done back for the crisis in that country.
So, Dr. Abdul Bari, that. We hope and pray that situation continues to improve in America as well as in Pakistan, because that little thing which nobody knew 6-7 months ago are making the whole humanity dance.
Yes.
All the economies shut down, people blaming and this and that. So that is a power of God Almighty. And so we pray that things go better for all people. Muslims and neighbor of other faith in America and abroad. But now people are working on medicine and people are working on vaccine. So in Pakistan, are there people focus on are part of the research on coming up with the medicine as well as vaccine?
Yes, yes, especially for the medicine, there are multi-center trials going on in many hospitals, many universities also. Some universities are also working on genomic of this virus also. I don't see anyone working on vaccines, but there are some universities which are collaborating with other international organizations who are working on vaccines.
Okay, so the medicine testing which is going on, is Pakistan being used for a guinea pig for some multinational, or these are local people who have developed some medicinal?
No, no, it's basically it's basically multinationals, which is it's a multi-center trial. It's not only Pakistan because COVID-19 is a new disease, and it's not so everyone in every country it is a multi-center trial. So it is not that Pakistan or a third world country is being used as a guinea pigs, basically.
So, if vaccine is developed, do you think Pakistanis? I mean, these are not just Pakistanis. A lot of Americans are skeptic of vaccines, and Pakistanis are also. Here we have conspiracy theories in America about vaccine, and I've heard the same conspiracy theories in different format exist in Pakistan also. So, do you think if
Mhm.
vaccine does come into being, it is going to be something people will go for it?
I think so, but it is far from coming. Basically, it will be another year or so when it will be into the market to be used. So people are there to use it. People, you if they hear about something, they are after it. It's because the toxic medicine came, basically people are after it because there was a very limited supply. Now people are after remdesivir. Now people are after the convalescence plasma. It's because people want something to be cured. So where there's one herbal medicine they call it sadamakki, and people basically sadamakki is the it's a laxative, and people are using it uh, for this COVID. So people will definitely use it. But it will be same like a vaccine developed. I don't know. It will be same as other vaccines for influenza, which we have. So, but there will be multiple strain by that time. I don't know what will be the fate of this vaccine.
Hmm. I was talking to a a top researcher in where whose focus is also on the medicine, and he was also saying vaccine is medicine is a faster and easier process than the vaccine process. Is that correct?
Yeah, vaccine basically it gives you protection from getting it. So it basically immunize you for getting infected from a virus. So it is not the cure. If you once you have it, you have it, and the vaccine will not do anything to that. It is basically whether you if there is a pandemic, it's epidemic, it will convert into an epidemic now after this. So people, if vaccine comes out, people will take it prophylactically, but it doesn't affect us. But when you have it, and hopefully some medicine will come also because some specific medicine. There is no specific medicine. Whatever medicines are there, they have they may uh, affect some people, but it is not a specific that this is for COVID. We can't call it that this is for COVID. So at this moment, it is as the time is passing on, we are learning as a medicine because it was a new disease. We knew nothing about it. It started from China. From their experience, we learned, and then as the days pass on. So I was reading somewhere. So those who were affected in March and those are who are affecting in June or July, they are less severity than it was previously than in March because we knew nothing about it. Now we know more about it, we are more literate about it, and we have some options how to prevent it. So use of steroids has come, use of anti platelets, anticoagulants, now which we use heparin is used. So we are more now educated for this, and what we may know by August or September, we may have some drug which is specific for COVID.
So, Dr. Mansoor, in the United States, the number of cases are really, really record high, but the death rate is not following that trend. So, do you think what Dr. Abdul Bari is saying is true about the United States, that this is this mix of different medicinal practices are actually might be helpful?
Yeah. One for sure that the moment that you have reporting of the positive cases, there's a lag phase between when the case is actually diagnosed to have the virus infection and the subsequent mortality. You get the infection, it takes some time to patient enter into the symptoms from mild and moderate, and the people who end up in severe. So there is always the time lag, you know. So I think we will uh, see some increase in mortality in the coming days. I think that will happen. That's how far, how big that mortality is will be less. Mortality rate will be less as compared to what we saw in New York. I think that is yet to be seen, and perhaps that now we are better prepared, little bit better prepared in the term of the availability of the ventilators. And then, of course, as Dr. Bari mentioned, I think we have at the moment nothing, I think, except the chloroquine was the only medication. But now we have the steroids. I think in a certain degree of cases, the steroids have been approved as
Yes.
well. And then the anticoagulant therapy, the whole, the virus itself, basically, yeah, once you get into the body, why it cause havoc in certain patients, why it does not cause the same severity, we yet don't know. But we know that what happens, at least some of the mechanisms that why the disease happened. For example, the lung oxygen problem is also related to the embolism, the clotting of the pulmonary arteries, and that's why the anticoagulant came. And then also so-called what you call the virus attack the body, and the body basically react, and they created, while attacking the virus, it create overdrive called the immune response. And that immune response not only trying to destroy the virus, but also becomes self-destructive for the lungs or the other body part. And for that, the steroids came. So as we are going along, we are having a better understanding how this virus basically caused the damage. And all these treatments are actually to decrease the damage caused by the lungs, mitigating. They are not, vaccine is the only way that we will prevent it. But once you have the virus, then there are different points where you can interfere.
Yeah.
The mechanism where the virus load is decreased. That's why the remdesivir came. Then after you have done that one, then the cytokine storm and the other
Yeah. Toxic.
how it is working.
Hmm.
That
Last question, I would, like you to reflect on that. United States have acute shortage of physicians, and because of ban on Muslim ban, and because of multiple policies, not many physicians from overseas, from the Muslim world, are coming. It has decreased substantially. While need and demand is there already. Is that reflecting in Pakistan producing physicians? Are more physicians available for Pakistani markets because they cannot get out of Pakistan as it used to be the case?
Definitely. As I said, because of this pandemic, the world will be different world, because now we are, whoever has to leave the country has to have a PCR negative certificate with them. So your cost of traveling will be higher than this, because we were approached by the UAE government to help them out for the testing. So uh, people can't go. Those doctors who came on vacations cannot leave the country because there are bans on flights also, and the production. of doctors is also at this moment they are all working on online. So
Yeah.
it will definitely we'll have more doctors, more physicians in Pakistan than before.
Hmm. Well, thank you so much, Dr. Abdul Bari. You're a pioneer in your field. And Dr. Mansoor Ahmad, truly appreciate you being with us and enlightening our audience. This is Imam Malik Mujahid, and you have been watching Muslim Network TV on Galaxy 19 satellite, Amazon Fire TV, Roku, and pretty soon we'll be on Apple TV as well. And thank you so much, Connor Mays, for producing today's show, and Sumaya Heather and Zahra Nadeem for helping out. Thank you. Peace.
Thank you, sir. Thank you.
Thank you so
Assalamu
much.
alaikum.
Peace and salam. Walaikum salam.